Let's get started by thanking our wonderful sponsors who make this show possible every week. We can't thank them enough. Many patients come to my practice thinking they have to stop wearing their contact lenses due to dry eye discomfort, but that's not the case. With products and services offered through ABB Optical's dry eye portfolio, like Regenerize Light, a biologic eye drop, I can help patients manage their dry eye symptoms and ship dry eye products directly through ABB, allowing me to have happy, satisfied patients. Interested in learning more? Visit abboptical.com/dry eye.
Vision Edge gives you less eye strain and reduced damage caused by blue light. We like to call Vision Edge sunscreen for the eye. It all starts with your highest level of visual performance, only achievable through scientifically proven Vision Edge.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Welcome back to part 3 of my interview with Dr. Art Epstein. In this episode, Dr. Epstein discusses cutting-edge treatment for dry eye disease. If you're new here and you like our interviews, press like, subscribe, share, and hit the bell to get notifications of great new interviews. And please leave comments. So how about heat mask, the OptiSource Sterilize or the Brutta mask? How effective is that? How does that help our patients?
It's funny because I've had, another epiphany. I'm very fortunate we were able to bring on a young associate. I was speaking in Cincinnati against my will. I really didn't want to do that lecture. It was kind of tired. I had to change planes. I used to love flying when flying was fun. I'd always get upgraded, and they had free flowing scotch, decent quality scotch as well. And I'd float my way to the lecture, delivered by a limo, and and now it's like sit in the back of the plane, and and I'm busy. I got other stuff to do, and so I'm in my curmudgeon stage, especially now with COVID. It's like flying. But so I was doing a lecture in Cincinnati, and I met this young resident at Cincinnati. Oh, he was a brilliant young guy. And he ultimately ended up, deciding to relocate to Phoenix, and he's been an associate with us for a couple of years. So, we talk all the time, about different things, and I kind of review everything with him. And when I was actually, I got lost in the process of answering your question.
So heat mask.
Oh, heat mask. That's right. Sorry, heat mask. It was such a hot topic that I actually I dropped it. It was hot. So we were talking the other day about heat masks because I had this realization. Heat masks, which I typically would recommend for everybody, I realize are not for everybody because there are some patients, to your point, who have inflammation, systemic inflammation, or localized inflammation, where heat isn't really the friend of inflammatory conditions. Inflammation brings upon its own heat, and when you're expanding vessels with heat, they're actually bringing in more inflammatory mediators. So there are a small percentage, maybe 10% of patients for whom I don't recommend heat masks, maybe a little more than that, but generally I do recommend, usually I recommend the Eye Eco Derm because I think it's the best made, cheapest, cost, I shouldn't say cheapest, it's the least costly and best made of all the devices. The Brutta is okay, and there's several others. They're more expensive masks. I don't think that really makes a lot of sense. At the very least, it's palliative. At the best, it actually does help loosen up my bum slightly. The lids are very thick, relatively speaking. They contain connective tissue, muscle, blood vessels, fat. They have a thick plate, the tarsal plate, which protects against a sharp object getting through. And all of that heat has to go through all of that to get to the meibomian glands on the other side. And most of the heat is wicked away by the blood vessels. In fact, the lids are designed to cool the underlying cornea through circulation. So you can imagine it's not very efficient at transferring heat. But yet, for some patients, it's enough to destabilize the gunked up meibum, the gunked up oil, and then with the blink exercises that we just talked about, afterwards. Following that, the destabilized oils actually start to pump out. So I have seen some patients actually benefit significantly from it. Typically, patients will stay on it as long as it's helpful or until they get bored doing it. And if they stop doing it, I don't yell at them. Sometimes I'll remind them, but patients will stay on it as long as it helps, and it does help a fair number.
And you mentioned goggles before. How effective do you think they are, and what type of patients do you use the goggles?
Well, we typically don't use goggles during the day, except in very extreme cases. So we're talking about, less than 1% of our patient population. They have to be really severe. And more often than not, if I'm going to use something that's going to create that type of environmental barrier, it's going to be a scleral lens, rather than a goggle. However, that said, we do use night shelters. And again, I hope I get a commission for this because they're the only ones who, to my knowledge, who actually make these silicone masks. I usually use an ICL 4.0 when I do use a mask because it fits the majority of patients. I use it in the clear. We stock all of this so that patients can purchase it and leave with it. I find that if they don't leave with these things, they often don't use them, which is exactly the opposite of what we want. They also make the onyx and the quartz, which I think they now call the night shelters or something like that. And all they are is basically silicone shields that seal tightly against the lids. And they also mentioned, they also make, as I mentioned before, something for CPAP users as well. So it just creates an environmental barrier. And if it's sealing well, when they take them off in the morning, it'll actually be wet. I mean, literally, it'll be like a terrarium under there. So they don't really dry out. They don't have to worry about overhead fans or things like that. A lot of the patients I use a product we discovered probably about maybe a year and a half ago, 2 years ago, which is European. It's made by a company called Ursapharm and distributed by Scope, which is in the United States, but they don't distribute that. It's paraffin based. It's a paraffin based ointment. Paraffin is not on the FDA list of approved constituents. It's called the monograph. It's the improved components of over-the-counter products for reasons I don't understand because it's benign. It's just in a very creamy formulation and it has vitamin A. The newest name is Hyalonite. They changed the name from Vita POS, I think because of the meaning of POS in the US, the fact that it was gaining traction here. And we have the patients titrate a small dab of it in the lower cul-de-sac, the lower portion of the eye before they go to bed, and it creates an effective shield and I don't even have to mess with the masks.
Let's talk about treating obstruction, the different ways of treating it and how effective it is and how easy and how hard it is.
Well, obstruction has really been a primary focus of the more advanced eye care practitioner involved in dry eye for a long time. And to some extent, that may be at least partially misguided. So the first approaches were using mechanical devices like a Mistrota paddle invented by New York optometrist Kathy Mistrota, who I think we both know. So a brilliant, lovely young woman who came up with very, very early awareness of the importance of meibomian gland function. And it's exactly what it sounds like. It's a little paddle, and you use your thumb on the other side and squeeze the lids. Not the most pleasant experience, but using heat beforehand can help. And then there are a number of forceps. I have one, the Epstein Expressor, and there's the Collins Expressor, and a number of others as well. I don't do those procedures really at all anymore because I don't find them helpful. The meibomian glands are very delicate, and you really can't heat the glands up enough. Using just warm compresses or a heat mask, at least in my opinion, to really be effective at loosening up, liquefying the meibum. We have a number of mechanical devices. The first one on the market was the LipiFlow from Tear Science, now owned by J&J. It was invented by Donald Korb. Very, very effective, completely automated, has a shell like a scleral lens, like that big cup you mentioned that fits over the eye with heating elements on the outside that go up against the inside of the upper and lower lid, and hydraulic pads on the outside that literally milk the glands. The next one was, I'm trying to think who came first, but probably Ilux, which was from Tearfilm Innovations, now owned by Alcon, which is a automated heating and expression device with an LED to give you an idea of how long you're doing it for, and some information on force and so on. And then Tear Care, which is made by Sight Sciences, which uses adhesive patches with heating elements and heat measurement devices to maintain the exact heat necessary, and also includes an expressor, really probably the best expressor on the market, along with it, so that after you're done, you can express, although I have used it without actually expressing the glands, just having the patient blink vigorously. In terms of cost, the most expensive device is the LipiFlow by J&J. Second is Alcon's, which is, had went up in price significantly once Alcon took it over. And TearCare is the least expensive of the bunch, and probably the lowest cost, certainly the lowest cost of entry for the clinician interested in adding expression. It's important to understand that expression isn't just expression. It's not just clearing blockage and obstruction. When you empty the glands, it's not that the glands don't communicate with the brain, that they're empty. In fact, we know that in normal patients, say, young teens, young children, that not every gland is working all the time. The brain is turning them on and turning them off sequentially. So there's redundancy and preservation of function. And likewise, pressure inside the gland is communicated to the brain. So the brain thinks the gland is filled, so it downregulates, sends a message, hey, stop making more lipid. So what you're doing by clearing obstruction, even partially clearing obstruction, is allowing for upregulation of production. And in many cases, I suspect upregulation is more important than clearance itself, which is a new concept that, I haven't, just began to explore, and probably quite new to most of our colleagues. But I think when we look at that in the context of homeostasis and, neurogenic control or neurotrophic control or neuro control of the ocular surface environment, I think that's going to ring more and more true as time goes on.
Behind you, you have R2D2, the IPL. If you could explain that.
Yeah. And actually, we have a secret love affair. Please don't tell anybody. It's one of my. It actually, it's funny. I tend to be a cynic. I'm a New York cynic. I'm the guy who, walking down Madison Avenue, sees them lifting a piano into a penthouse. So I will stop, stand across the street where no shards of that crashing piano could possibly hit me. Waiting to see who's going to get hit by the piano. I always think, like the worst is going to happen. No, not really. In reality, I tend to be, I think, much more positive than that. But this is a Luminous Optima M22, which is an absolutely gorgeous instrument. The engineering is just superb. And what it is it's a unit that delivers intense pulse light. Intense pulse light was first introduced probably about 25 years ago by Luminous, and it was designed to treat rosacea, which is an inflammatory condition of the sebaceous glands of the skin. Not fully understood, but it's believed to be associated with staph, hypersensitivity, or perhaps Demodex. And it applies light in a controlled fashion, both in terms of intensity and the number of pulses within a given pulse sequence, as well as the frequency of the light that's getting through. It uses a series of cutoff filters. And it was discovered probably about 8-10 years ago now by Rolando Toyos, who's an ophthalmologist in Memphis, that his patients who were getting aesthetic treatments, its other primary utility was for aesthetics, scar reduction, removal of age spots, dermal regeneration, facial rejuvenation. He discovered that many of those patients who had dry eye reported that they were doing much better with their dry eye symptoms, and he began to look at it, and that led to increasing realization that this was having significant impact on meibomian gland function. And it's actually quite amazing. I mean, I literally don't have words fully to express how shocked I was at how well this works. It went from something that I thought would be only for a small subset of patients to something that we use more than any other technology when we do use procedures. We still use expression technology, but this by far is what we use most. What it does is it reduces inflammation. Again, some of this is anecdotal based on my experience. A lot of it is based on research that's been published. We see increased activity on a mitochondrial level. Mitochondria are the energy centers of cells. So we see upregulation of cell activity, increased myelin production. I see structural recovery. So structure that has been damaged now recovers. And we see disinfection, photodisinfection, where Perriman is a brilliant ophthalmologist who focuses on dry eye, reported on killing Demodex effectively. We see, just general improvement. It's been kind of linked to a process called photobiomodulation or photomodulation. And I think it's because of the unique engineering of this device. It delivers, say, 30 units of energy in units of 10 separated by a resting pulse, or units of 2 or units of 3, or whatever you want. So we typically use 3 pulses. I said 10, I should have said it will take 10, it'll break it into 3.33. So it'll break it into 3, or it'll break it into 0.5, or into 5 rather. So we use a triple pulse. And I think that triple pulse literally shakes the glands. Like, it's not painful at all. It's actually quite reasonably comfortable. And patients show improvement typically after the 2nd to the 3rd of 4 treatments. And we do maintenance treatments afterwards as well. There are also collateral benefits in skin. That's obviously not our focus, but we've remarkably seen, massive improvements in, quality of skin, reduction in scarring and things of that sort. But, in terms of eyes, which is where we're focused, game changing for many patients.
Some of the newer models have like a mask that you could get to use to deliver energy. Have you any experience with that, and do you have an opinion on that?
Asking me if I have an opinion is asking me if there's sunshine in Florida every now and then, or if it'll rain in Florida just once a day. I definitely have an opinion, and unfortunately, it's not very positive. And the reason is, if you look at IPL, you're looking at, number one, you're looking at 25 years of innovation for this company. The engineering, I sometimes joke with patients that this thing is capable of knocking a plane out of the sky. If I turn up the energy high enough. Of course, that's an exaggeration, but this thing is built like a NASA grade device. Number one, the amount of research, especially in the derm literature, is just exhaustive, and the amount of research in the eye care literature is probably approaching 80 to 100 refereed decent quality papers. This mask, which comes from Europe, is a bunch of LEDs, which you can buy on Amazon if you like. And there's one refereed paper on it. It's being sold by one of the companies that's promoting it, and some of our experts in turn are promoting it as well. Some say it works. I don't see it. My mind's not close to it. A year from now we may reconvene. And you may say, what do you think of that mask? And you'll see me, wearing the mask, lights flashing like Las Vegas or something behind me. But, at this point, I don't see enough science to justify it. I refereed a paper on, something similar at one point, and, the paper was, laughable. I mean, it wasn't laughable. It was actually cryable. It was a very sad, anecdotal bunch of nonsense. And I think, sticking a mask on someone to flashing LED lights until it's proven, this works. I know it works. I have literally hundreds of patients who will tell you it works. And that's what I'm all about. I just, like I said, outcomes are what I focus on. We'll see what happens with that. Maybe it will work, and I'll get to enjoy a nice meal of crow and mask.
Yeah, a number of years ago at Arvo, True Tier, there was a number of papers on it, and it's kind of a funny technology, but the papers seem pretty good on it, but it hasn't seemed to catch on yet. Do you have any experience with that?
Yeah, actually, we had True Tier. True Tier is now off the market. That's relatively recent, so you may not be aware of it.
No.
And the reason why it really was not a commercial success. two things came out of that. I think it was from Stanford, if I remember correctly. There was a mechanical device which was acquired by Allergan, which was quite odd considering it's primarily a drug company, and that was TruTear, which is what worked for some patients, and I'll explain how in a second, but not commercially successful. There's another device whose name I forget. It's a small company. It's just being introduced that uses sonic waves to stimulate the trigeminal nerve around the nose. There's a branch of the trigeminal nerve, which is that big conduit that goes from the surface of the face and the eye up to the brain, which controls the ocular surface among a host of other things. And this uses sonic waves to stimulate the trigeminal nerve. And then there was a medication or a nicotinic agonist, I believe, that was also proposed in this original research, which is now being developed by Oyster Point. And essentially the way it works is it stimulates the trigeminal nerve, which is almost the equivalent of taking a thermostat that's malfunctioning, again, assuming that you're managing a dry eye, which is a dysfunction or malfunction of an essential element in the maintenance of normal ocular surface environment, and you're stimulating you're stimulating all of the different elements that contribute to its function. So it's not specific to any one thing. In other words, it doesn't turn on meibomian gland function alone. It would also turn on lacrimal water production. It would turn on mucin production. And therein lies an interesting question. Is that really going to be sufficient? Is that going to work? Based on my experience with TruTear, in some cases it very well may. Will it be mainstream? It's hard to say. It's a blunt approach to a very elegant, complex problem, and sometimes using a sledgehammer to nail in a picture on the wall doesn't have really good consequences. But from my perspective, the company's done a lot of research. I'm awaiting it with some element of excitement, the Oyster Point product. And if it works, great. I'll be the biggest proponent of it. And if it's about as effective as pulling a nose hair in terms of making your tear, you'll be hearing about it next time.
Touche. At Allergan Eye Care, their goal is to protect and preserve vision. It's not just what they do, but it's who they are. They've been creating innovative products and services for providers and patients for over 70 years, and they continue to push the boundaries of what's possible in eye care each and every day.
Macular degeneration is a leading cause of vision loss, with 15% of Americans being at risk or already affected. Scientific evidence proves that by using mesozeaxanthin, lutein, and zeaxanthin together replenishes the macular pigment and promotes healthier vision. This formula comes in only one product, MacuHealth.
Amniotic drops.
Amniotic drops are again one of those miraculous things that if you have segments as you're passing from this world to the next, and your life runs before your eyes. If there's a segment that is professional, amniotic drops would be one of those things. And amniotic membrane in particular would be one of those things that would pass before my eyes as one of the true miracles, along with IPL and a couple of other things. So amniotic drops, I think there may be more than one manufacturer. I'm really familiar with Regenerize, which is made by Regenerative Processing Plant, which is a small Florida company. I think they're in Palm Harbor, Florida. The founder is Dr. Randall Harrell, who I had the pleasure of meeting a couple of years ago. He's a plastic surgeon, very bright guy, and was very much interested in regenerative medicine. And the plastic surgeons several years ago, maybe 10, 15 years ago, when they started doing intrauterine surgery, were amazed that babies were having open heart surgery, having valves replaced and being sewn up, delivered, and coming out like, maybe 3 weeks, 4 weeks later, and with no scars apparent, complete healing of the scars. And it was associated with or attributed to the healing powers, the growth factors in the amniotic fluid. So he began experiencing with amniotic fluid sourced, as he told it to me, from full-term pregnancies, from C-sections in volunteer patients, and developed skin fillers and a number of other things, and eventually realized the best and most impactful use was for eye drops, and came out with a product called Regenerize. They now have a product called Regenerize Light. I've had amazing success for some patients, and I've had no success with others. Overall, it's a very helpful adjunct. It does help when I have patients who have gland loss and I need regeneration. I'll go with that. When I have patients who have really severe surface staining and I want something that's ongoing, I'll go with that. When I have patients who have a really severe surface disease, I'll go with amniotic membrane. And I don't know if you're going to separate that part of the discussion, but I might as well just continue along the road. So amniotic membrane came from the mind of Sheffer Sang, who is a brilliant ophthalmologist who's located in Miami now, and he recognized the healing powers of amnion, basically, the tissue in placenta. Came up with a company called BioTissue, and it's a, NASA. Again, I use NASA in the strongest positive sense of the word, NASA grade technology company where they have cryo preservative rooms and things of that sort, and he produces membranes in various carriers, either to be sutured in place or in contact lens like carriers, that probably the single most clinically impressive stuff I've ever seen in my career. You can take one of these amniotic devices, Procara is the brand name. A patient can have a corneal ulcer that I know from experience would end up with massive visual loss, resulting in maybe 2200 vision, maybe even worse. Put in this membrane along with an appropriate antibiotic, and when all is said and done and the infection is managed, and the amniotic membrane is removed, the patient ends up with a pristine cornea and 20/20 vision. I mean, it's to say it's remarkable is an understatement. In dry eye and ocular surface disease, it's not a treatment for dry eye per se, but it is a very, very effective treatment for severe ocular surface disease, along with other conditions that are related, like recurring corneal erosion and so on. So, that's a very, very important and very helpful tool for some patients when appropriate.
Regenerize is 1 to 2 times a day.
Yeah, typically for most patients, it's twice a day. For the Regenerize Light, we'll have them start up to 4 times a day and then cut back to 2 times a day. The original Regenerize, really needs to be coddled a bit. It, needs to be refrigerated when possible. Although once it's open, it'll last for 30 days, without refrigeration. But if it's going to be taken once a day, it should be refrigerated. The light version can be just carried around like a regular drop.
And how long are they on it for?
In some cases, forever. I mean, it's that's the other thing. I'm very judicious with medications and things like that. A little bit less so with natural things like Regenerize. But for some patients, it's the difference between function and dysfunction, and they'll stay on it. The original Regenerize is quite expensive. It's a little under $200, although it's discounted in volume. But the light is actually quite affordable. So I don't prescribe it. It's not prescribed for every patient, but when I need it, it works well.
I know that ABB is going to be distributing it now.
Yeah, we're actually thinking of actually carrying it in the office. We hadn't before, but it's at the lower price point, making it more affordable with very similar characteristics to the original. It makes sense. I think it's a very, very helpful adjunct for many patients.
Have you seen any side effects from it?
No. Of course, you're always worried about, using body fluids, tissues, and things like that. But, the reality is they go through an FDA very stringent process. So, my wife's used it, my, staff has used it. So it's, we're not concerned about that. We've never had any adverse reactions.
Autologous serum.
Autologous serum is, there are a lot of things that people do reflexively. I know, and I probably shouldn't say that, they do it because it works for them. We used it for a while, and um, I find it's easier now. There's a company, I think it's called Vitalize, that actually, will arrange for the blood draw and arrange for it to be spun down. But frankly, when Regenerize came out, I found it to be so much more effective that I, pretty much abandoned autologous serum. Every now and then, Corey Lappin, my associate, and I talk about going back and trying autologous serum for a handful of patients, but I typically don't use it. The reason why people use it is because it has growth factors and stem cells and things of that sort, theoretically. And there's platelet-rich autologous serum, and there's variations of it. And some people use it with good success, but I find that Regenerize actually is a more practical, slightly less expensive, and in the case of light, much less expensive alternative.
Bandage contact lenses.
I walked in. I walked in the other day, I don't know if I dreamt it or I was during my shower, which is one of the few moments where I have peace and quiet, where my brain can work in isolation of
I actually did a podcast on that. You're going to have to watch it. We haven't released it yet, but it's coming out.
Okay, so this is benign. This is
how water is, it makes people come to places and to be able to think, and how calming and the psychological effect of water.
It may be, it may well be. I find that some of my best ideas actually come from that. So I walked in and I said, you know what, Corey, we just had a patient who was really difficult to manage, and we use a fair number of bandage lenses, bandage lenses. And anyway, I said, a bandage lens is an artificial environmental barrier. That's what we're doing. We're creating an artificial environmental barrier, call it an AEB. And he said, oh yeah, that kind of makes sense. Because what it basically does is, when the eye can't do it itself, you can use a contact lens to create that shield, that stabilizing factor. And then, we started going through it in a little bit more detail, and I went back and I kind of clarified. I said the reason why it was such an important revelation, if you will, is because when the eye is functioning properly, is we have a natural environmental barrier, which is the tear film. So we end up using the artificial environmental barrier when the natural barrier fails. Which to me is like, that's the brilliance of that. And it seems self-evident, but you'd be surprised. Well, you wouldn't be surprised, but many of your listeners would be surprised that many of our colleagues, are afraid of complications and afraid of other things. And it's really a risk versus benefit issue. And the benefits for many patients so far outweigh the risks that bandage contact lenses could be game changing. Like, for example, that rheumatoid arthritis patient that I had mentioned earlier in the podcast. Bandage lenses were one of the things that saved her. I mean, really made a massive difference.
Let's two more scleral lenses. I know that you're big with scleral lenses, and you see some very severe cases. Explain your successes, maybe some of your non-successes, and what kind of side effects have you seen?
Yeah, in scleral lenses, it's funny. I don't do a lot of lens fitting. My wife, when we first opened a practice, within a week or two, I was going to, obviously coming from New York, I was the big contact lens kahuna, if you will, and so I was going to be the contact lens guy. And at that point, I hadn't limited my practice, just to dry eye and surface disease. So she called me in one day and wanted me to evaluate a bitoric Rose K something or other. And I looked at it and I said, that's a lot better than I can do. Congratulations, you are now the contact lens expert here. So she dove into scleral lenses. I think a lot of people get lost when they try to use older technology to evaluate what's going on with scleral lenses, and assess the fit. I think OCT, ocular coherence tomography, gives you a very, very precise estimation of fitting relationships. So to me, that's essential for a really advanced, very good, successful fit. Now, there are other ways of getting that type of information. Eaglet Eye, I think, is a company that makes a profilometer, which measures scleral topography, recently introduced. Pentavision makes not Pentavision, the Pentacam. Pentavision is a publisher. Pentacam, made by Oculus, also gives you peripheral information that can be very, very helpful. We find, I'm somewhat hesitant to use scleral lenses because the success rate with a patient who has keratoconus, which is a degenerative condition of the cornea, as you well know, with a scleral lens is excellent. It's like 90 plus%. Likewise, pellucid's another degenerative condition. Scarring, very high success rate. Dry eye, much more difficult. So I'd say I can't give you an exact number, but it's certainly less than 90%. And it's not for lack of technology. It's not for lack of understanding. It's not for lack of trying. It's because the environment is much more challenging, and as good as scleral lenses are at separating the eye from the outside environment, sometimes they have difficulty in managing the inside environment. We use them for more severe patients. We use them for patients who have, for example, graft versus host disease, which is a very, very severe form of dry eye, with good success. The worse the patient is, the more likely they are to be successful. But we use them for patients for specific purpose. One of the first sclerals we fit in a dry eye patient was a woman who had very severe meibomian gland loss and very severe dry eye. And she was an avid hiker and wanted something that would allow her to hike without, the dust and dirt and sand from, the Phoenix hiking trails getting in her eyes. And she's become a devout scleral lens wearer and much better, dry eye patient as well as a result. But if a patient has reasonably, moderate to, worse dry eye and other things are working, we won't jump on the scleral lens bandwagon. We haven't seen any severe complications. Basically, just fitting issues or handling issues are usually the worst of it.
And acetyl carnosine drops. I think they were originally developed in Russia.
Actually, certainly in Europe, we did a clinical trial back when both of us were youngins for an Italian drug company. I don't even know if they still exist. It was my first real clinical trial for Angelini Pharmaceuticals. Angelini Pharmaceuticals had developed an in-eye contact lens cleaner for L-carnosine, which is an antioxidant, a free radical scavenger. And they were originally in use in Russia and in Europe as a cataract preventative or a cataract treatment, with mixed literature. Some literature says it worked, some literature says it didn't. Angelini found someone found, and Angelini pursued it, that this would work as an in-eye contact lens cleaner. Now, of course, that has to be taken in context because, today you'd say, well, who the heck would put in a drop to clean a lens in your eye? You'd take the lens and throw it away because, everything's disposable. But back then in the, late 80s, lenses, if they didn't last a year, the patient would come back and, go, hey, you fit me with a defective lens. What's the matter? Well, it ripped after, 10 months, it's like, so lenses were, intended to last and did last, for quite some time. And they sometimes get pretty gunky. So I have some amazing photos from back then of calcium and, debris buildup. And it actually was a reasonably effective in-eye lens cleaner. And they just discontinued it. There was no, the disposable lens was introduced shortly after the clinical began. Handwriting was on the wall, and they discontinued it. So it filtered down to the nutritional folks. And I was working on a patient with very severe surface disease. Had to travel, probably about 80 miles to get to the office each way. And she was reading a book on nutrition and read about these drops that she was able to procure on Amazon, which I think were OcuPhase, and said that she was doing amazingly well. And sure enough, she was doing amazingly well. Staining had reduced dramatically. She was doing very, very well. Essentially what it does is it scavenges free radicals, which is the molecular foundation of inflammation, with no negative effects. Comfortable for the majority of patients. OcuPhase comes with 2 little bottles that are refrigerated until they're opened, and it's quite inexpensive. It doesn't work for everyone, but when I run into a dead end, I will, sometimes pull that out, and it runs in cycles. Sometimes I'll, use like, 10 bottles, 10 boxes of it a month. Sometimes I will use it for 2 or 3 months. But it's a good thing to have in your back pocket just in case.
How long do you keep people on it for?
Again, as long as they want, it's an over-the-counter product. So, if the patient finds that it's comfortable, some patients have said this is the most comfortable drop I've ever used, and other patients have said, this thing burns and stings like like you put gasoline in my eye. So I kind of leave it up to the patient. I will obviously question them, and most patients that do well slowly back away from most things, not everything. But it's kind of like a testing the water type of approach for many of the patients.
Have you observed any changes in cataracts by using it?
I haven't, although I have 20/10 vision and I drink it every day. No, I have not. I haven't. I did look at the literature. Some of the literature is pretty interesting. I think there's a lot of things that we're not privy to. And I think, I don't think we want to get into a long discussion of therapies and COVID and things that have been downplayed and suppressed and upplayed and commercialized. But, I tend to take some things with a grain of salt, and I tend to sometimes look very closely at grains of salt.
So is there anything that we didn't talk about that you'd like to discuss?
Hey, sure. When I was a kid in the Bronx, I literally think we've, this was really enjoyable, but I think it was one of the most comprehensive discussions I've ever had, in part, because of your knowledge. And so I think, for the lay public and maybe for our colleagues as well, hopefully this will be a good foundation. I think we're moving towards a more holistic perspective, and a more wraparound end-to-end perspective, that dry eye is a part of a bigger picture, a systemic picture as well, which is, I know, something you're highly focused on. And I think, this concept of homeostasis, once we stop saying the word homeostasis and really begin to grasp what it means, will be, I think, a way of unearthing some of the real interesting mysteries, if you will, that underscore the complexity of dry eye. And I think the realization that what we're actually seeing is this incredibly, exquisitely beautiful, intricate process that allows us to function through vision in a challenging world, in a challenging environment. And to me, probably the greatest part of this journey, which is probably the hallmark, the icing on the cake of my career, is that the more I understand, the more I understand, and the more I understand, the more I realize the beauty of what we have. We sometimes don't appreciate, when we get up in the morning, how many things have to work right for us to be able to do that. And the eye is this tiny little surface area. Tears are tiny little bits of water, but the beauty and the elegance is actually quite remarkable. So if I convey that in any way, and people appreciate just how fortunate we are to be here and to have all that working, and to have people like you who's willing to take time to share that with others, I think then this was time well spent.
Well, beautifully said. I thank Dr. Art Epstein. He's a wealth of knowledge. If people want to be your patient, they want to know more about you, how could they do
That's a good question. No, we keep them away. Stay away, folks. The practice is called, thanks, Gary. I don't mean stay away. We really welcome patients, literally from pretty much everywhere, and we welcome questions as well. So the practice is Phoenix Eye Care. My end of it is the Dry Eye Center of Arizona. It's essentially a practice within a practice. We're located in Phoenix at 3805 East Bell Road, Suite 1800. The phone number is 602 602-549-2020, 602-549-2020. And if anyone has any questions or whatever, happy to answer them. If you want to reach me by email, the easiest way is artepstein@gmail. That's Art Epstein, one word, @gmail.com. And if you actually reference, I guess the show or Dr. Gelb's name, I'll recognize it as a question, and it won't get stuck in the no, I don't want to buy real estate in Puerto Vallarta at the moment pile.
Again, I want to thank Dr. Art Epstein, the fabulous Dr. Art Epstein. Thank you for joining me today. This is Dr. Kerry Gelb for Open Your Eyes. Stay healthy and well. Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
Since I bought Safe For You, my dad makes me clean his boat.
Es natural y es un buen producto.
Every time I go back to school, my mom always makes sure that I have my Safe For You products. I bring extra, and my roommates certainly don't mind.
It's a good thing I had Safe For You to clean up after this little guy.
When my hands get dry, I like to wash them with Safe For You.
And most importantly, the reason why I buy Safe For You is because it's safe for me and you.